Okay, guys, chapter 24, GI system infections. Let me grab a drawing utensil and we'll get on our way. Okay, structures. This is an AMP2 topic, and again, I know many of you guys have not had AMP2, so I will go through it. GI system, we've got the GI, gastrointestinal tract. That is the big long tube that starts at the mouth and ends at the anus. And most of these guys are going to be surrounded by peritoneum, at least the ones in the abdomen. I don't know why they've got it phrased like that. We've also got accessory organs that assist the GI tract in moving and breaking down and absorbing nutrients. We've got such things as teeth for grinding food. We've got the pancreas and the liver. All of these are involved in there. These guys digest the food to get the nutrients absorbed and put them in the blood, get water, and eliminates the waste, what's left over after we've gotten everything we need from whatever it is that we've taken in. Components, we've got the mouth, the esophagus, the tube that leads from the mouth, or strictly speaking from the pharynx to the stomach, the small bowel, the colon, and then the rectum and anus. Okay, here's kind of a picture of mouth. This is the pharynx, the throat area. Uvula, the teeth, the tongue, these are all involved. There's that esophagus. There's the stomach, which connects to the small bowel, which goes all the way around and finally connects to the colon, which comes up this way. There's the pancreas behind the stomach and the liver to the right of the stomach, or actually left if you're facing it. Structures, teeth and tongue, salivary glands. These are the guys that make saliva that contain things that help us to break down. The liver produces a bile that helps us to break down fatty foods. And the liver is also going to be the source or the initial stopping point, or at least waypoint, for the food after it's absorbed. The gallbladder stores that bile. Pancreas makes all kinds of enzymes to break down different foodstuffs. The normal flora in the GI tract, the esophagus, the stomach, and the first part of the small bowel, which is called the duodenum. These regions are pretty azenic, not totally, but fairly. These guys undergo peristalsis. Peristalsis is where the tube-like GI tract squeezes and propels things. Rapid transport of the food doesn't stay there long, helps to keep the microbes from getting a foothold. The tongue, the teeth, jejunum, ileum, colon, and rectum. One of the most common bacteria there, especially in the mouth, Viridian streptococci. The lower small bowel and the colon, we have normal flora here, we've got bacteria, and these guys actually help us. They're antagonistic to the really bad guys, the pathogens. And we have the mucous membrane around the inside of the GI tract to prevent the bacteria from having access to our blood. Bacterial diseases of the oral, dental caries, gingivitis, and periodontal disease. Caries are holes or little indentions in the teeth. Periodontal disease, gums swollen, tender, bright red, bleeding. Gingivitis is like the first stages of periodontal disease. Streptococcus mutans is going to be one of the guys that causes those cavities. This guy has dextran and pili and helps them to form biofilms on the tooth. That's the plaque. Porphyromonas gingivalis causes the periodontal disease. He has a protein breaking enzymes that breaks down the tissue of the gums. Most adults are going to have dental cavities or caries. Uh, that's because we have a high level of sugar in our diet, and that increases it. That sugar makes these guys go wild. And what happens, guys, basically, these guys consume the product. Their waste product is an acid, and that's what burns the holes in the teeth. Caries, the dentist just looks at your teeth. Fill the cavities if you catch it earlier. Gingivitis, again, they just basically look at the teeth. They can use scaling, and they also have antibacterial rinses that you can use. Prevention is the best way to deal with this. There is a decay, more decay, really bad decay, and that's what it looks like, kind of like on the x-rays. Tartar, plaque is this hard substance, but tartar is very, very hard. So that plaque would be the biofilm. Tartar is like calcified. It is very hard. That person has not had a lot of good dental care. Uh, that person looks like, look how red those gums are. And look at that buildup of tartar there. Bacterial biofilms, the plaque, produce acid, dissolves tooth enamel. Eventually, they cut all the way through the enamel and get to the inside of the tooth where the root area, which is where the blood vessels and the nerves are. Healthy gums, first stages. I think we already talked about that. You guys can look at that for yourself. Trench mouth. Specific bacteria, Prevotella intermedia, Fusobacterium species, Treponema vicente. These guys cause an acute necrotizing ulcerative gingivitis. What a name. But look at those. Look how bad that is. And you can see the gums should be down here. So this person has already lost a lot. Trench mouth. Vincent's disease. Severe periodontitis characterized the erosion of the gums, ulcers, lots of pain with chewing, halitosis, extreme bad breath, because these guys are nasty bacteria. Dentist does this with a visual examination, x-rays. Patient needs cleaning, pain medication, antibiotics. Oral thrust, candidiasis. Candida albicans is a normal part of our flora. It's a fungus. It overgrows when it gets the opportunity. This is candidiasis. White. You can scrape this off with like a tongue depressor. That's how you tell this from oral leukoplakia, which we'll talk about in chapter 25. This is something you see mostly in babies because their immune system isn't quite up to snuff. In adults, you only see it when they are very immunosuppressed. Think full-blown AIDS. Oral thrush is one of the names. Some bleeding. Nystatin, swish and swallow, clotrimazole, oral suspension. Some sort of antifungal oral is what you're going to use. And that little sweet baby, whoops, make sure I get my pen. That little sweet baby has got an enlarged, swollen parotid gland. This baby has the mumps. Viral disease. It's a paromyxovirus. It's got H and N, just like the hemagglutinin and neuraminidase spikes, just like the flu. Fusion protein helps to fuse the viral envelope to the plasma membrane of the host cell. This is a respiratory droplets, contact with contaminated saliva. It's easy to get into epidemics with this. We have a vaccine for this, which anybody with any sense will use. Clinical signs and symptoms, diagnosis confirmed with laboratory, virus identified with culture or polymerase chain reaction. Most effective way to keep from getting this is to get a vaccine, MMR. One of the M stands for mumps. It used to be common, now it's kind of rare because of the vaccine, but as people become anti-vaccine protesters, then we may see it back. Peptic ulcers used to be a real problem, and a lot of people had to have parts of their stomach removed from this. It was thought at that time to be a psychiatric thing, stress related. Stress does aggravate it, but actually it's caused by a bacteria called Helicobacter pylori. Abdominal pain is going to be the main symptom. It's going to be like a gnawing pain, and it's a very good reason for feeling like that. H. pylori has flagella that enables them to get through the lining of the stomach. They have adhesions to attach to the gastric cell, and this is the big part. They have something called urease that neutralizes the stomach acid, but this also neutralizes. Okay, there's the lining, there's the wall of the stomach. There's a mucus coat there, and there's the H. pylori. He's going to release that, and he's actually going to cause holes to form in the mucus coat. That enables him to get to the gastric cell. It also enables that acid to get to the wall of the stomach, and that's what a peptic ulcer is. Fecal oral transmission, very likely. Stress will worsen it because it makes you produce more stomach acid. It doesn't cause it, it makes it worse. X-ray exam to identify ulcers. You do this with an endoscope. They used to do a urease breath test, but I don't think they do that. You can also do a blood test for antigens associated with H. pylori. This guy is treated with a combination of 3 antibiotics. You can also give these folks omeprazole, Prilosec, that lowers their acid production. Prevention by avoiding fecal oral transmission, which is if you eat out, you don't know. Peptic ulcers, that's really, those pictures are too small. You can't really see. Red, angry looking, holes in it. And by the way, yes, that stomach acid can burn a hole straight through the stomach and dump stomach acid on the inside of your abdomen. That's called a perforating ulcer. So it's the mucus layer that these guys suppress, and that's what causes disease. Oh, by the way, the 80% of these ulcers are actually in the first part of the small intestine that hooks to the stomach, called the duodenum. So it's 20% are actually stomach ulcers. Bacterial gastroenteritis, bacterial infection of the stomach or the intestines, usually from contaminated food or water, or just generally poor living conditions. Just people don't have enough. These guys are going to be the same, bacteria, virus, what have you. Nausea, vomiting, diarrhea, abdominal pains, cramps. Dysentery is a special kind of diarrhea. It's got loose stool and it's got mucus and especially blood. So dysentery is a bloody diarrhea. Shigellosis caused by Shigella. There are 4 different species. These guys have different enterotoxins in the secretion systems. These guys are going to colonize the cells of the small and the large intestine. We diagnose these by the symptoms and presence of Shigella in the stool. Supportive treatment and antibiotics. These guys make a toxin called Shiga toxin. I don't know why that wasn't on here, guys. Shiga toxin causes a lot of the problems. Shigella, here's attaching to the epithelial side cells of the colon. So this is the lumen of the colon. Gets endocytosed, multiplies inside the cell, invades neighboring cells. Abscess forms, cells are killed. Shigella enters the blood and destroyed. It will not cause a bacteremia. Salmonella will. Shigella won't. Traveler's diarrhea. Traveler's diarrhea. E. coli is infamous. Oops, gotta get my pen back. E. coli is infamous for causing this. There are many types of E. coli, different strains. The virulence factors, adhesions, fimbriae, and of course toxins. And there's actually a type of E. coli that produces a Shiga toxin. Pathogenesis, epidemiology, diarrhea caused by those enterotoxins, very common in developing countries. Diagnosis, signs and symptoms, treatment, fluid and electrolyte replacements, and this is very important. Do not take Pepto-Bismol, do not take kaopectate. If you take drugs that keep you from having diarrhea, then you're just going to keep the bacteria in you that much longer. Let's kind of come to an understanding. Diarrhea is your body's way of flushing out bad guys. If you stop the diarrhea, then you keep the bad guys. So there it is. Campylobacter diarrhea. Campylobacter jejuni is the most common cause of bacterial diarrhea in the U.S. Adhesions, cytotoxins, the endotoxins, bleeding lesions, inflammation. Chickens are the main source of human infections. Got to make sure that chicken is cooked. Diagnosis on signs and symptoms. Most of these are going to resolve without any kind of treatment. Proper hygiene when handling raw poultry. If you're cooking chicken, you've got to make sure you wash your hands before you rub your nose or get it anywhere near your mouth. Clostridium difficile. This guy is caused when I give my patients a broad spectrum antibiotic and it destroys the normal flora of the colon. These guys are allowed to overgrow and they cause this very nasty disease. It's called pseudomembranous colitis. Severe cases, Clostridium difficile. It's caused by overgrowth. These guys produce 2 different toxins that cause inflammation and this pseudomembrane. We treat this guy with metronidazole, Flagyl. If that doesn't work, we try vancomycin. C. difficile. Any bacteria, any antibiotic that kills off your normal flora will allow these guys to overgrow. And there's the pseudomembrane you can see. You can find the toxin in the stool. We treat it with antibiotics. And that's why we don't want to use broad spectrum antibiotics. We want to get targeted as much as possible. Salmonellosis and typhoid fever. Salmonella enterica. There are different serotypes. There's a typhi and paratyphi. Paratyphy is going to cause typhoid fever. Serotypes Enteritides and Typhimurium cause salmonellosis. These bacteria, most of them cannot tolerate the acidity of the stomach, and so they're going to pass on to the intestines. They're going to produce toxins which are going to interfere with cellular processes. Typhoid fever, you're going to get that from contaminated food or water. Salmonellosis, a lot of times you can get that from contaminated eggs. Salmonella from those, and chicken, and from pet turtles, all kinds of places. They diagnose this by taking a stool sample and finding the salmonella. This is usually self-limiting. Typhoid fever will treat with antibiotics and proper hygiene and just good common sense. Salmonella can get into the blood. Salmonella going basically through the same steps that we had with Shigella, but this guy does have the ability to get into the blood and cause a bacteremia. I would remember that if I were you guys. Cholera is caused by a Vibrio cholerae. It's a comma-shaped bacteria. It's in salt and fresh water. And when it's inside the human body, it turns on a gene and it makes the cholera toxin. There have been lots of pandemics in history. I think it's really more epidemics. Diagnosed Rosswater stool, a grayish-whitish stool is what comes out. Supportive care, doxycycline. There's a vaccine, but it's only short-term. Proper hygiene is the biggest thing. Having a safe water system. Cholera, well, we'll go through it here. Cholera toxin binds to the membrane of the cell. The toxin is part of it's going to enter into the cell, and it's basically going to cause this guy to shoot out chlorine and sodium. When it does that, the water is going to follow. So you're going to get a massive dehydration. That's the real danger with cholera, is dehydration. And, well, you're going to also lose electrolytes. That's also a problem. And that's also why you're going to have such humongous volume of stool. And it's going to be that gray-white color. Bacterial food poisoning, intoxication. Intoxication is not a happy thing. Food poisoning, nausea, vomiting, diarrhea, cramping. Staph aureus can be one of the guys. Ooh, I keep losing my pen, but I keep finding it. Staph aureus can be one of the guys. Some of these guys have lots of enterotoxins. Outbreaks, usually when we gather together. Picnics, places where food is left out, family gatherings. Food is left out, that's the key. Diagnosis, signs and symptoms, fluid and electrolyte replacement, that's going to be the main thing. This is kind of intense, but it's generally short-lived. Proper hygiene, yeah, but it's more about protecting your food and making sure you don't leave it out, especially things like potato salad. Mayonnaise is infamous for breeding Staph aureus. Okay, viral diseases. We've done away. We've got through the bacterial. Very similar, and like the bacterial, any kind of diarrhea we're concerned is with dehydration. Caliciviruses, astroviruses, rotaviruses. Probably some of you guys have heard of rotavirus. We give babies rotavirus in vaccination. These guys are going to infect the endothelial cells lining, not the endothelial. Yeah, endothelial cells. No, epithelial cells. Sorry, guys. It's late in the day. More cases in the winter, people are closer together. Rotaviruses, a lot of child deaths in developing countries. Why? Because they don't always have access to fluid replacement. Children die of dehydration. Serologic testing, fluid and electrolyte replacement. It's a virus, right? Proper treatment of water and sewage, good hygiene, and get that rotavirus vaccine. It just makes good sense. Viral hepatitis. Ooh, I've got it, but it's giving me a funny color. I want my green back. Okay. Viral hepatitis. Hepatitis, this means it's going to infect the liver. There are several kinds, A, B, C, D, and E. Signs, jaundice, that's the yellowing of the skin, especially the eyes. Abdominal pain, fatigue, gonna feel tired, vomiting, weight loss, and symptoms can happen years after initial infections. Some of the hepatitises are going to be chronic rather than acute. Liver damage, again, that's going to be due to the immune response, not to the virus. Hepatitis A is the acute form. It can kill you. This can turn into fulminant hepatitis. Hepatitis B and C are chronic, and these guys can cause liver cancer. So there is a vaccine for this guy. There's a vaccine for him, but normally most people don't get that unless there's a need. Hepatitis B, you should get vaccinated. Hepatitis C, no vaccine. They got some good treatment nowadays. There for a few, like a decade or so, it was touch and go. Hepatitis Delta is an acute, especially dangerous for pregnant women. Hepatitis E is one that can only survive with hepatitis B. You have to have a co-infection. Initial diagnosis, jaundice, enlarged liver, fluid in the abdomen. Why would you get fluid in the abdomen? Well, because the liver makes the proteins that help to keep our fluid in our blood vessels, the albumin. And so when the liver is not making that, your albumin levels go low and your blood vessels get leaky and you get a lot of fluid leakage, especially in the abdomen. And then serological tests for antibodies and antigens. Hepatitis B, they look for the viral proteins. Supportive care for symptoms. Alpha interferons, nucleotide analogs help reduce levels. Interferon, if you guys remember back when we were talking about the immune system, is going to give a heads up to surrounding cells to help them prepare to defend themselves from viral invasion. Nucleotide analogs these are phony things that look like a nucleotide that you can use to make DNA and or RNA, but they actually are dysfunctional. It's a counterfeit nucleotide, and so by giving those to the virus, they will use them to make faulty copies of themselves. Good hygiene, stick with one partner for life, or don't go doing anything. Vaccines for A and B. You guys can look at this for yourself. Don't think there's anything that's really I got that exactly mixed up. Hepatitis D has to go with B. Hepatitis E is that acute form that's especially dangerous for expecting women. Giardiasis. Giardia is a protozoan that is just about in every freshwater in the United States. That cream, crystal clear freshwater, you drink it, you may get this. Sometimes it's asymptomatic. Sometimes it will cause diarrhea that can last up to a month. Giardia intestinalis. These guys have cysts, and that cysts are resistant to things like chlorine, which is what we use to purify our water, heat, drying, stomach acid. These guys have got a tough little means inward. This happens anywhere. There's a lot of Giardia in the U.S. People who go hiking and drink from streams, that's where you're going to get it. You get cysts from contaminated water, food, or even from other hands. Hikers, campers, swimmers, these are going to be the risk. Again, if you suspect it, ask these people what they've been doing, and they'll tell you, well, I was camping. Okay. Diagnosis, treatment. Diagnosed Giardia in the stool. Flagyl for adults, or furazolidone for children. Obviously, I've never seen a case of this. Prevention, you gotta clean the water up, filter it. Okay, cryptosporidiosis. Signs and symptoms: severe watery diarrhea, serious complications. Cryptosporidium parvum. Pathogenicity, we don't really know how it works. Drinking contaminated water is how you get it. Oocytes, those are basically eggs. In the stool samples are how we diagnose it. Fluid and electrolyte replacement, and again, proper hygiene. Amoebiasis, another fresh water. Luminal amoebiasis is asymptomatic as long as it's inside the lumen of your intestine. Invasive amoebic dysentery, severe diarrhea, inflammation of the colon, appendicitis. Invasive extraintestinal amoebiasis. These guys can cause necrotic lesions in different organisms depending on how invasive they become. These are caused by the Entamoeba histolytica. It's an amoeba. Virulent stains have proteins that are toxic to our cells and help them to invade. Tropozoites in the peritoneal cavity or blood cause the symptoms. These guys are in contaminated food, water, hands, or that is gross. If you do that, then you probably deserve to get an infection. Majority of individuals are going to get the luminal amoebiasis. Human carriers help to maintain transmission. Microscopic observation of entamoeba in stool or in an intestinal biopsy. Oral rehydration therapy. Anti-amoebic drugs. Proper hygiene. Yeah, that goes without saying. Individuals in endemic area, you should drink bottled water and don't eat uncooked vegetables or unpeeled fruits. Again, goes without saying, hopefully for most folks. Cyclosporiasis, intestinal disease, protozoan cyclosporal cayetanensis. Okay. Endemic to tropical and subtropical, uncommon in the U.S. Lost my pen again. I don't know how I keep doing that. However, there have been outbreaks, contaminated produce, where the protozoan is more common. And we get a lot of our fruits and vegetables from tropical and subtropical areas. There's a picture of Mr. Personality. Some folks are going to be totally asymptomatic. Some will get explosive watery diarrhea, fever, nausea, vomiting, cramps, loss of appetite, fatigue, bloating. May last for months without treatment. Bactrim is the recommended treatment. Bactrim is $4 at Walmart. Helminthic infections, talking about the worms. These are macroscopic, multicellular. These are worms. These guys infect the GI tract, but They're parasites, but they generally don't cause disease. Tapeworm is what we normally call the cestode. It's a flat worm. It has segments. It's definitely parasitic. These guys don't have a digestive system. They hook onto yours and suck on it. Usually asymptomatic. You can get nausea, abdominal pain, weight loss because they're taking part of your food. Diarrhea. Two common ones, the beef and the pork. Tapeworm, Taenia saginata is the beef. Taenia solium is the pork tapeworm. And these guys split their life cycle between their primary and secondary. You have to cook your food, guys. Tapeworm infestation, worldwide, pork and beef are food. Inadequate sewage treatment, humans living way too close with the livestock. There's the head of a tapeworm, scolex, and they've got hooks to hold on. That's the cyst form. Presence of proglottids in the fecal sample. I said these guys were segmented worms. And what happens is these segments will break off and pass out, and they are capable of growing an entire new worm. That's a proglottid. Niclosamide or praziquantel, thoroughly cook your meat. If you like things rare, don't. Ascariasis, that is a big worm. That's in an intestine, and that's what somebody's pulled out. Large nematode roundworm, these aren't segment ascaris. Lumbricoides, soil transmitted. 800 million to 1 billion people have this. That's sad. Infections, warmer climates, tropics, warmer times of year. Uncommon in the U.S., the eggs transmitted contaminated food and water. If the food is grown in places that they use human manure for fertilizer, this can happen. Or even not even human manure. You can get this from other animals too. Usually asymptomatic. If you get symptoms, shortness of breath, cough, nausea, diarrhea, blood in the stool. This guy can actually migrate to the lungs, by the way. Abdominal pain, weight loss, fatigue may be visible in the stool, and in certain cases like this, they can actually block the intestines totally. Normally, this guy is self-limiting. Mebendazole, albendazole, and severe cases, they may actually have to do surgery to remove them. Hookworm. These are nematodes. America, Africa, Asia. Necator americanus is U.S. and Australia. A Clostoma duodenale is found in Europe, Africa, Middle East, Asia. And this species found in animals, cats and dogs, can penetrate human skin and migrate, causing cutaneous larvae migrans, which is the disease caused by those. See the larvae of these hookworms are actually under the skin, and they're causing that reaction. As they move across the skin, you get this pruritic, itchy. Signs and symptoms, cough, they migrate to the lungs too, initially. Itchy rash, loss of appetite, pain, diarrhea. Hookworms can affect physical and cognitive growth. Albendazole, mebendazole, pyrantel, palmiate, used as needed. Strongyloidiasis. Strongyloidiasis generally caused by Strongyloides. Stercoralis, soil-transmitted worm, free-living and parasitic. Parasitic, the larvae penetrate the body through the skin, especially bare feet. Transmission through organ transplantation or facilities like daycare can occur. Signs and symptoms nonspecific, rash where they enter, cough, dry or with blood, fever, nausea, difficulty breathing, bloating, pain, heartburn, rarely arthritis, or kidney complication. Ivermectin is preferred treatment. Albendazole is secondary. That's why I never go barefoot in Georgia. Is that enough toes? 1, 2, 3. I need one more. Okay, guys. Pinworms, nematodes. I've seen these in the hospital. Long, thin, unsegmented. They're round. Signs and symptoms: itching in the anal region, irritability, decreased appetite. Third of the cases are asymptomatic. Enterobius vermicularis. Females crawl out to the anus of a person and lay their eggs at night. Eggs dislodge and spread the disease. Very common in children. Most common parasitic worm in the U.S. Again, this is one reason I do not go barefoot, but other folks can do what they like. Diagnosis: eggs or adult pinworms. Actually, what we do is we take a piece of Scotch tape at nighttime, put it on the child's penis, and pull it off and look for the eggs on the tape. That's how we do it. Parental pamoate or mebendazole. Strict personal hygiene. You don't want those nasty things crawling out of your bohonkus at night. Flukes, flatworms, leaf-like appearance. Type of trematode, multiple species. Liver flukes and intestinal flukes are some of the most common. Liver flukes cause disease by interfering with our bile duct. Fasciolaceae caused by Fasciola hepatica and Fasciola gigantica. Contaminated raw or undercooked aquatic plants. Gotta be careful if you eat watercress. Fasciola flukes develop in the bile duct, release eggs into the feces. Fasciola flukes cause acute infections when they do. Signs and symptoms: nausea, vomiting, abdominal pain, rash, fever, malaise, breathing difficulties. Triclabendazole. Obviously, I've never had to use these drugs, guys. That's why I'm having to stop and figure out how to pronounce them. Clonochiasis caused by Clonocris sinensis and contaminated freshwater fish. Other flukes, such as Opisthochorus viverine, which are also found in fish, and Opisthochorus thelineus, found in freshwater snails, cause infections. And the last one, guys. Intestinal flukes, trematodes develop in the intestines. Fasciolopsis busci causes fasciolopsiasis, closely related to liver flukes. Intestinal flukes, contaminated aquatic plants that have not been properly cooked. When the cysts are consumed, the larvae emerge in the duodenum and develop into adults. While they attach to the epithelium, release eggs into the stool. Intestinal flukes is often asymptomatic, but mild diarrhea and abdominal pain if it is. Vomiting, nausea, allergic reactions, and anemia with severe symptoms and high loads, high numbers of parasites, and can oftentimes in high loads lead to intestinal obstruction like we saw. Diagnosis the same as the liver. Examination of feces or other samples. Praziquantel is used for these. And that's got chapter 24, guys. I'll see you in 25.